everyone. Welcome to another episode of the TeleWellness podcast. I'm your host, Martin Hamilton, and today we get to speak with Dr. Gabriela Hurtado Alvarado. On today's episode, we discuss trauma-informed care that is neuroaffirmative and culturally grounded. Dr. Hurtado Alvarado is one of the people that leads Prickly Pear therapy and training. It's based out of Austin, Texas. It's a bicultural mental health practice. They are trauma-informed and culturally affirmative as a practice, and it provides interventions that are understanding of the experiences of trauma and multicultural identities. Their clinicians are experts in Latinx mental health and leading professionals in culturally grounded care. They work to facilitate healing from painful emotions through a collaborative approach centered in empowerment and hope. Hi, welcome, Dr. Hurtado Alvarado.
Thank you for having me. I'm really excited to be in this space with you and get to talk about, trauma-informed care in our practice and the work that we do.
Yes, I really have a lot of questions, and I think of the general audience too. Like, I don't know, for listeners out there, probably have a lot of questions. Like, what does trauma-informed care even look like? What does it mean? How can it benefit others? And but before we dive into that, why do you do the wellness work that you do?
I came into this field really through like a branch of activism in college. And so part of what I wanted to do was to do research and use those tools to like really address the challenges we were seeing in our community. And in that process, I landed in grad school and, worked as a clinical psychologist. And one of the things that was limiting about, and continues to be limiting about our field, is that we don't include BIPOC populations in the treatments that we do, in the research that we do, in the consulting that we do, right? And so a lot of these approaches fall short, or we need to adapt them in all kinds of ways for them to work in our community. And so that's how Prickly Pear came to be. Me and my colleague Josie Serrata actually came together in a space for Latina researchers because we were looking for mentors. We were looking to connect with people with similar interests. And so we came together in that space, and we were talking a lot about the different ways that this work can be challenging. And so we decided to found Prickly Pear and do implementation of evidence-based practices, of somatic work, of different styles of healing in our practice, but also bring in a lot of mentorship and a lot of organizational structures for the folks that are working along us, so that they can get supported, so that we can get training on specific interventions and on healing, culturally specific healing practices in a supportive environment, in an affirmative environment for our practitioners, but also and for our clients.
Oh, I love that, for practitioners and for clients. And I love that question too, and that's why I ask it at the start of everybody, every episode, because so often I think the why, sometimes it's so eye-opening to hear people's story behind the background, the training, the dissertation, the time in clinical training and hours, and establishing a practice. I love hearing the heart and the story behind what drives that passion, because you have to be committed. You have to be committed to show up to do that. Because just to give people a background and understanding about how many years have you been dedicated to this thing? Because you mentioned, there was activism in college, and that led to grad school, and you have your PhD. So how many years has this been something for you?
So I went to college in 2006 and graduated from my PhD program in 2015. I had to go through my program a little bit faster because I was an international student at the time.
Okay.
So I usually would add another year to that. And then, we're required to have time that is supervised in order to get licensed as a clinical psychologist. Not every psychologist is in clinical right. settings, and so they might not go through that path. But in order to get licensed, you need at least 1 year of supervised experience after getting your PhD. And so it's been altogether almost 17 years to get here.
Wow. Wow. Well, I really admire that. So I just wanted to highlight that, because I know from colleagues who have gone the route that you have gone through, the passion, it really has a lot of commitment, hours, blood, sweat, and tears, truly. And so I just really admire that. And for those listening too, when the depth of expertise and dedication to this topic that you have just is really, really admirable. And I that's why I'm also really excited to get to speak with you one-on-one and pick your brain.
Thank
So
you.
for those listening, can you explain the concept of trauma-informed care a little bit and its significance when it comes to mental health?
Absolutely. And I just realized I want to say 17 years since I'm to get here to
Yes,
where I'm right now.
yes,
But
yes.
overall, it's a while. It can be like
It's a
10
while.
plus
No,
years.
I think people are always surprised. I think because I think sometimes psychology, I don't want to generalize for everybody, but I think in the field of psychology, there are lots of different paths you can take. And then also on top of it, not every field within mental health does the same thing.
Right.
And sometimes I think people might think like, oh, maybe you're learning how to ask questions or different things, but some people are focusing on research or some people are focusing on clinical interventions, assessment, creation, and statistics. There's so much. And one of my goals with this podcast is to also inform people like what goes into
Yeah.
the background, the training into when you go into that therapy session or you schedule, your consultation, just kind of the preparation that it took to get there. So yes, not I
Yeah.
understand it wasn't all that, but just the level of
Yes.
commitment to this, to where you've arrived now. So
No, and I love that because
yeah,
I think that's something that when you're in it, right, you can forget
yeah,
how long it took. And so I think that also gives us pause, right, in valuing the work and the expertise that we bring. And
yes,
for folks to know, right, like when, as you're saying, like when they connect with us, what does that mean? What are they getting when they're connecting with
yes,
us? For sure. For sure.
yes, exactly. I mean, I was really when I read your bio, to me that really stood out. So I was like, yes, I get to speak with this expert in this field. I want to pick her brain. So yes, I'm curious if you could share a little bit about that. Like, what is trauma informed care and its significance in mental health?
Yeah, so trauma informed care became a buzzword, I think, like in the last 10 years, right? And so it was a paradigm shift in our field where we were having conversations and then requirements and then guidelines and in practice about understanding around what trauma is and how it impacts the individual and how that shows up in the room outside from the direct interventions that we have. How does it show up in organizations? How does it show up in our communities? And so, what we really mean by that is that when we have folks that come from an event or events that have changed the way that their nervous system functions and in long term, right, impact the way that they see themselves, they see the world around them, where there isn't a lot of trust or safety, then it's going to impact the way that we connect with one another, the way that we connect with, in our case, with providers. And so there's a lot of different things that we can do to then provide a sense of safety from the get-go. So that starts when we have our websites up and people can find information about how our offices look like, what we look like, what our backgrounds are, what our stances are and approaches are to the care that we provide, so that people, we're being open and transparent about that. And then having a lot of collaborative practices to make sure that people feel empowered, understood, seen, and safe. And so, what we want to make sure as part of trauma informed care is to understand what folks are going to need to feel safe and be able to show up authentically in the room, which is key to then be able to develop rapport and be able to develop a relationship to then implement the work that we're in our
Yeah,
space to do. So things like having our policies and procedures outlined for people to read and also having conversations about what those look like, answer questions, have a very collaborative approach where we are meeting people where they're at, all the way to how we orient people to when they're coming to our offices, letting them know what to expect,
Yes.
what, how long things are going to take, what they're going to be asked to do. And then in the therapeutic process, really creating trust. And one of the biggest interventions that we'll do is going to be in what happens in the room live, and that therapeutic relationship. Of course, we have like different strategies that are really important. And for people that experience trauma, especially complex trauma, then it's going to be really important that we are even more open, that we are even more intentional about the space that we create, so that it feels and is a safe space for people to show up.
Yes. Oh my gosh. The level of mindfulness and intentionality and the things you described really speak to wanting to help create, like you mentioned, kind of that grounding, because you're right, trauma is so disorienting. It could be so disorienting. And you highlighted that it changes the nervous system. So of course it's going to change perception, change how we everything. And I think that is a really compassionate approach, not just like clinically strong, right? But like very like it sounds very compassionate approach with empathy and dignity, and giving your clients the opportunity to know exactly what to expect. Sounds like it was really, really, really helpful. And do you find that there are specific, maybe cultural practices or interventions that you find effective or helpful when working with individuals who have experienced trauma who are part of the Latinx population that are
Absolutely.
culturally sensitive?
Absolutely. And I think that, when I'm somebody that was trained by behavioral, and so I was trained in DBT and ACT and CBT. And so those interventions were helpful for folks that were in certain points of their journey, right? And that had access to resources. And I don't only mean financial or time, but also a lot of regulation, right? To be able to engage in a lot of that cognitive work. And so where we start is with a lot of folks is bringing in a lot of somatic work. And so understanding where folks are at in that regulation journey from trauma healing. And so we bring a lot of those practices that are very consistent to not only the presentation that we see with Latinx folks or in general folks of color, where a lot of the stress is really somaticized. And so we use both evidence-based strategies like the stress tolerance module, emotion regulation from DBT, but also somatic experiencing and mindfulness-based, breathing-based practices in the room, very present focus to what is going on, and being able to monitor our clients and then practice a lot of those different skills in the session in the moment. And then we use, in addition to a lot of regulation skills and psychoeducation, we do use a lot of narrative approaches to therapy, and really trying to make a lot of the concepts that we're educating our clients on more approachable, more consistent with the way that we talk in our community, and addressing a lot of the stigma around mental health, and really working on our clients creating community, really amplifying the social support that they have. And when we're talking about different interventions, for example, for interpersonal effectiveness, for social skills, really focusing on cultural values and how those look in our community. And so implementing those different skill sets is going to look different. And so really working on a true application of those skills in a way that is culturally grounded.
Wow. And do you find that there are certain stereotypes? We're talking about culture and being culturally grounded, certain, I don't want to like spend too much time talking about necessarily like the stereotypes, but I think it's important to bring up perhaps any possible misconceptions about trauma within culturally diverse communities that you see, whether it's in training others or within your own practice, maybe how people feel that they should be, or and how can we address those?
Yeah, I mean, there's definitely a lot of shame about mental health in general. So for folks to be struggling for folks that are struggling with mental health concerns, there's not really a lot of openness to talk about it. And the other piece is that a lot of our communities are in survival mode. And so there hasn't really been a room to address things like trauma and intergenerational trauma. And so there's not a lot of things that we talk about. So when we start naming things, I think keeping those terms very neutral is important, right? So we're explaining intergenerational trauma without judgment to address shame, to address the stigma, and to also understand that a lot of our folks are doing the best that they can. And some of the things that we're doing might not be helpful, right? Or may actually be harmful. And so I think that is the first one, is that we might not talk or believe that mental health concerns have a real impact, because we have to put them in a container inside of us to continue moving forward, because we're in survival mode. And I think the other big concern is that we don't know what therapy actually looks like. And therapy is not something that is talked about. It's something that, is for a certain group of people, or that is for quote unquote crazy people, or people that quote unquote can get it together, right? And so that might mean that you're not strong enough if you're in therapy. So a big chunk of recovery is really addressing how that stigma is internalized, even when we've done a lot of work to be aware of these things, and therapy and healing is aligned with our values, we might still have a lot of internalized shame. And so we put that front and center, and we talk about that and normalize a lot of those different emotions and coping mechanisms and coping skills that we have, in the context of survival, of what we have available, things that are helpful or unhelpful. And so I think those are the main two that I see a lot in the groups of people that we work with, aside from the somatization of symptoms. And so not connecting that a lot of those somatic symptoms are part of mental health as well.
Yeah. What are some of those that you typically see of those somatic symptoms?
A lot of migraines and headaches, a lot of chronic body pain, a lot of gastrointestinal issues, a lot of autoimmune disorders. Usually in folks that have experienced complex trauma for prolonged periods of time, what we do see is that there's development of chronic illnesses, autoimmune disorders, just chronic GI issues. Those are the main ones.
And I meant to ask earlier about complex trauma. Can you give just a general overview of what complex trauma is compared to just to other trauma, just complex
Right.
trauma specific?
Yeah, and let me distinguish them. So when we talk about trauma, we talk about an event that had adverse consequences for our mental health, right? Where somebody felt like, or truthfully, like their life was at risk, right? Their safety was at risk, and there's this negative impact that event has had in the way that we see ourselves in the world around us. When we talk about complex trauma, we're not talking about one discrete event, but we're talking about multiple events that happen during a prolonged period of time. And so those are things like domestic violence, interpersonal violence, child abuse, child sexual abuse, things like all of that on top of immigration, racism, discrimination. Those are things that compound and will have different impacts on top of the dysregulation, the negative affect, and negative ideas that we have about ourselves and the world around us. We also see a big impact on the way that we connect with others in relationships, because we've learned that people are not to be trusted. We've learned that maybe our system and our way that we see the world is not to be trusted. And so we will show up in a very different way interpersonally, will really impact that. And then we have developmental trauma, which is when these events happen at times that are critical for development, especially during childhood or adolescence.
Earlier you mentioned, because you're right, there are so many layers, and everyone's experience can vary based on what they experience within trauma, and I'm assuming that brings different presentation when they come to therapy. And we talked about some of the maybe shame or guilt or assumptions that are negative when it comes to maybe being open to therapy or thinking about therapy. So I kind of want to bring some light to what you see happen when people start healing. So we know what they feel like. Okay, we talked about maybe migraines, stomach complaints, and this is what they might feel like therapy is maybe not for them because they should be strong enough. And but when they do walk in the door and they take that courageous step and they're talking with you and they now know what to expect because they're there with your practice and they're starting to do the work, the healing work. What are some of the first signs of kind of the recovery and healing that you see people experience?
I love that question because it's a question that we get a lot with when clients are coming in. It's like, how would I know that I'm getting better? And so
Yeah.
we talk a lot about that piece. And then when we're wrapping things up, we, do kind of like a flashback to all the things that they've done. And so a lot of them can connect to some of the things that I'll share. So I think first and foremost, most of the clients that we see that have experienced trauma, complex trauma specifically, our practice really works with a lot of folks that have that experience. We see a decrease in suicidal ideation, both passive and active. A lot of our folks are chronically suicidal, especially feeling very hopeless for a long period of time. And so we start seeing a shift in that, as well as in reasons for living. So a lot of folks, when they come in, they have a few, relationships or things that they're looking forward to. And then we start seeing them connect with those things that really motivate them, really are a source of joy, of engagement, right? And that really have them connect with this will to live and to this will to create a life that is enjoyable and pleasurable, and that is worth it. So those two, and I think interpersonally, one thing that we see a lot is that when folks are coming in, they're very guarded, and there's a lot of distrust. And so when we're recommending different skills and coping strategies, there's a little bit of, oh, okay, I'll do it, but this is not going to work out for me. Like things are always been this way and they'll continue to be this way. And so then we see a lot more openness to trying different things, to applying them, to tolerate that things aren't perfect. We start moving away from black and white thinking, or a lot of our folks do a lot of intellectualizing. So we move away from that. And we also start seeing folks, which they hate that I use this phrase of sitting with your feelings. And so, being present in a moment with their emotions, to be able to recognize the different things that are happening for them before an emotion shows up in this very intense way, as well as when they do have those intense emotions, what can we do? How can I take care of myself? And really implementing a lot of those skills on the daily.
I bet it is such an incredible thing to witness, that transformation. That sounds wonderful. I wanted to give everyone an inside view to see like how can they feel better? What does it look like? Because I know that when you feel lost, it's hard to imagine like how will this work for me and what could I feel like, and that things can get better. And just to hear the ways that you see that present itself for your clients is so encouraging. So Dr. Hurtado Alvarado, I really appreciate you being a part of our wellness journey today. How can people connect with you, and in what states do you see people? You see people outside of Austin, right? Remotely.
Yeah.
So yes.
Yeah, so you can connect with us in social media. Our practice is there under Prickly Therapy, and we're on all social media platforms. And I'm on Instagram as La Doctora Hurtado. So that is one way. And also through our website, pricklypeartherapy.com, where you can contact us through there, see what our practice is about.
How can people connect with you? And you see people all through Texas virtually, right?
Yeah, so we see folks virtually in all the state of Texas. Dr. Zarrata and myself are site pack providers, which means we can see folks outside of Texas, and there is a list of a lot of different states that are part of this. This is like a passport that allows us to see folks across different states, and so Sadly, it's not every state in the United States, but there's some.
Yes.
And
Yes.
so folks can check that out. Those states are listed on our website,
Okay.
and more information about PsyPact is there. And we also see people in person in the Austin area, in nearby areas, or hybrid models, especially because we do therapy, but we also do assessments. And so we're able to do those assessments in hybrid form and, if appropriate, virtually.
Okay. Oh, good. That's great news because I wanted to make sure that people can get access to you. I mean, and
Yeah.
all the amazing work that you're doing. And I'll make sure to write those links in the show notes. And also, prior to recording, I was talking with Dr. Hurtado, and I found out that y'all are also hiring. So if you're listening and you're a provider, also maybe reach out because and you're interested in working with Prickly Pear therapy.
Yes.
Sounds
Thank you.
like a wonderful place to work at. So just wanted to give that shout out too. But
Thank you.
thank you so much for being here and for being part of our wellness journey.
Thank you so much for having us.